Hi, I hope you're having a great day and I hope you're staying safe at home. Over the last couple of days, actually ever since the lockdown started, we've seen an increase in cases of people with asthma, adults as well as kids. And, we're trying to figure out when we talk to these parents or we talk to the people who have it, was this the same before the lockdown? And a lot of people are experiencing more triggers of asthma now. And we're kind of relating it to many, many things. People are spending more time in their air-conditioned homes. And if your air conditioners have something called mold growing in them, that can trigger off your asthma attack. It's different for everyone. In fact, we've seen so many cases, I decided to make some notes and break this down. Let's understand, because a lot of people with asthma out there believe that their only way out is an inhaler or that they can never get rid of this. Am I saying that you can cure it? No. But can you make it better? Absolutely yes. Some children with asthma grow out of it. Some children with asthma or adults, when they recognize the allergy or the allergen or the particular food that triggers asthma, and you take that out of your diet or you make that lifestyle change, guess what? The number of asthmatic attacks that you get or the dependency on the inhaler reduces. So it's always good to understand your condition and what's happening in your body. Asthma comes from the Greek word. It means shortness of breath or panting. These are two symptoms that people with asthma have. The first misconception, everyone thinks that, you have a difficulty breathing, inhaling. But with asthma, the problem actually is that the difficulty is with exhaling. You can inhale, but because your bronchi, it gets constricted, because the bronchial tubes in your lungs, they're very narrow and they further get constricted, trapping air in your air sacs at the narrow end of your bronchial tube. So you have trapped air and it's difficult for you to exhale it. So if I'm taking a deep breath, I take an inhale and I have a clean exhale. I take an inhale. If I'm unable to exhale because of the constriction of my tubes and the trapped air in those air sacs, what's going to happen is I'm going to start gasping for breath. I'm going to start having a shortness of breath and I'm going to start hyperventilating. So we should never get confused with that. It's not the difficulty to inhale, which is why being calm when you have an asthmatic attack. I know it's easy for me to say that. I've never experienced it. But when we're able to calm down people who are hyperventilating, they realize, because what is it? It's the fear that you cannot breathe. So we immediately think, the subconscious mind thinks, cannot breathe, which means I'm going to die. Cannot breathe, which means I cannot get oxygen, which means I'm going to die. You already have it in you. The difficulty is getting it out. So we must try to remain calm while we go through this. Now, we have mucus in our lungs. We have mucus all over our body. Mucus isn't a bad thing. Mucus is meant to protect us. It works as part of our immune system. So when there's an allergy or a virus or a bacteria, the mucus basically breaks down an enzyme, and that enzyme helps us to fight a particular bacteria, pathogen, dust, or whatever it is. So sometimes when you have very less mucus, it's a problem. And when you have too much of mucus, it is also a problem. So coming down to asthma, you'll find that the patient gets restless, they get very weak and fatigued. That's mainly because of the respiratory problem. You're not able to pass out too much of carbon dioxide and you're not able to breathe the right way. So the patient must rest when they have an attack and after the attack immediately. The wheezing that you hear is nothing but the constriction. So if I want to pass air through a pipe of a normal size, and now if I constrict that pipe and I pass air through it, if you've ever heard air passing through the crack in a window, if you've not really shut your window completely and you have air passing it with a high velocity, you're going to hear like a whistling sound, like a wheezing sound. That's exactly what happens in an asthmatic patient. So there's nothing happening to you at that point. It's only that you have a constricted bronchial tube and the air cannot pass out, or it passes out with force, and that's what creates the wheezing. So what can we do? What causes asthma? A lot of people like to blame it on genes and say it's hereditary. Well, it can be, but it doesn't mean that there is no solution for it. You see, a lot of us inherit the bad gene as well as the lifestyle. So if person A's parents had asthma, but person A's parents were also eating the wrong foods or not taking care of the allergens that were triggering off the asthma, you also inherit that lifestyle, which means your asthma doesn't get better. But is there something we can do? Absolutely yes. What are some of the causes? An allergy. So for some people it's dust. The moment dust gets into their lungs, it interferes and irritates with the mucosal linings, and then you have the allergic reaction and your bronchial tubes constrict, and you have an asthma or an asthma-like condition. For some people, it could be dust mites. For some people, it could be mold. This is something that we see a lot, especially in the rainy season. When parents come and say, hey, Luke, our child's asthma or our asthma is becoming more and more. There is something called fungi and mold that grows on the walls. You can't even see this sometimes. And if you really look closely or shine a bright light on the wall, you'll find mold growing on your wall. And that itself is an allergen for you. You clean it out, you get a dehumidifier, you change the temperature of your room, you clean your air conditioners, all of a sudden, your triggers, your allergens are continuously reduced. Even food. What are some of the most common foods that we see? Milk, dairy, wheat, sometimes certain nuts, sometimes chocolate, sometimes eggs, sometimes certain beans like maybe a rajma or a chana. But this doesn't have to be for all of you. You need to really do something called elimination, where you eliminate the foods. Do you feel better? Then you get a clue that these foods are triggers. If you don't, then you can eat those foods. So it's always good to do an elimination protocol when it comes to foods to determine if any foods are triggers for your asthma. Sometimes foods don't have to make you uncomfortable, but they're enough to trigger asthma. For example, gluten in wheat, is highly inflammatory for the gut. It creates inflammation. Your gut and your immune system are directly connected with each other. Sometimes if you're lactose intolerant and you consume lactose or lactase, that may be a problem for you, and that may induce the trigger for asthma. Also, sometimes it's none of these things. It could be foods, it could be certain drugs. Certain medications that you're taking can also induce asthma or asthma-like effects in you. So you want to check your medicine list, what you're taking. Perfumes. Some people are allergic to perfumes, or that fragrance or that smell can trigger it off. Irritants in cosmetics, in creams, in shampoos. These are all little things that you can look for. Now, you can also have asthma if you have a muscular weakness. So some people are underweight. They have very weak lungs. They have sedentary lifestyles. They don't work out. Their lungs are weak. If you're underweight, your lungs don't have the ability to function at its efficiency. So sometimes we can have asthma-like symptoms even if you're very weak or you're underweight. So you see a lot of sometimes senior citizens, when they get old, they lose protein, they lose a lot of weight. Your lungs are like a muscle. They require energy. If you need to cough, you require energy. You need to break down mucus, you require energy. So you can have those symptoms if you're underweight as well. Emotional stress can also trigger off asthma. When you're constantly stressed, you produce inflammation in the body. So stressful environments can trigger off asthma. Tension, pollution as well. Infections, certain infections can also do that. Now with the COVID, what we're seeing and what we're hearing is something called a cytokine storm, where it's a kind of an autoimmune which creates a cytokine attack. Your own immune system attacks your lungs, giving you symptoms of the COVID as well as symptoms of asthma. So we need to understand that your immune system plays a huge role in the health of your lungs. So even bacterial infections, viral infections can trigger it off. Now, what can we do about this? Your food plays a huge role, like I said. You want to find out if there's any allergens in your food, any particular foods, inflammatory foods that trigger it off. And if yes, you want to make sure that you don't eat those particular foods. Detoxification. A lot of us consume a lot of toxins through pollution, our foods, junk foods, too much of sugar. And that's why when you look at Ayurveda, and why it is so powerful when it comes to asthma, because Ayurveda works on the principle of removing all morbid toxins from your body. Are your excretory organs, are your eliminatory organs working well? That is your lungs, your liver, your kidney, your bowels, and your skin. If you are accumulating toxins and acids in your body, you have more mucus formation. If you have too much of mucus formation, that also impacts your body's ability to deal with allergens, bacteria, and viruses. So we got to look at detoxification. We need to understand that sugar and junk food increases inflammation and increases mucus in your body. So it is so important for people who are asthmatic to reduce your consumption of sugar or use healthier sweeteners, things like jaggery, things like stevia, things like raw honey, natural fruits, and all of these things over your refined sugar and your junk food. If you eat a lot of oily food and deep fried food, again, it can trigger off mucus formation, which again can trigger off asthma or an attack. Yoga, certain asanas and pranayama works beautifully with people who are asthmatic. So you may want to get in touch with your yoga teacher or yoga therapist who can understand your condition, understand your body, and prescribe 3, 4, 5 asanas that can really help you, as well as pranayamas. Pranayamas train your lungs to use oxygen the right way. Most of our clients and patients who practice pranayamas, every time they get an attack, most of them now no longer use an inhaler. How does the inhaler work? It's a bronchodilator. It basically, that puff allows your bronchi to open so you can breathe comfortably. But pranayama can work like a natural bronchodilator as well. The more you practice it, your lungs learn, they get trained how to breathe even when it gets constricted. So that is so powerful for you. Your exercise, your blood circulation as well. Now let's go into some of my favorite concoctions that work. Like I said, it can work for many, it doesn't have to work for many. So try it, it works for you, great. If it doesn't, it's not just the concoctions, it's your overall lifestyle that you have to change. What we find that works really well for people with asthma is in the morning, fresh lemon juice with warm water and a teaspoon of raw honey. This really gives you relief, and it's great for your lungs as well. Now, a lot of people add ginger to that as well. So again, you can do lemon, you can do ginger, you can do honey. You never heat the honey, plain raw honey. And you can even add a dash of Sri Lankan rolled cinnamon. This by far has been one of our most powerful concoctions. Now, for other asthmatics who have a lot of congestion and difficulty in breathing, you get thyme. You can get thyme, it's an herb. You can order it on Amazon, they're dried herbs. And you take a tablespoon of thyme, you take a tablespoon of methi seeds, those are fenugreek seeds, and you boil them in water and add maybe 1 or 2 black peppers. This will loosen up all the mucus in your lungs, allowing you to breathe better. So it actually helps you to reconstruct the mucus, the mucosal linings, not just in your lungs, but even in your gut. So that works really well. We spoke about eliminating sugar and junk food, early dinners. A lot of asthmatic attacks happen when you're sleeping. You do not want to eat dinner and go straight to bed. Get your dinner at least 3 hours early before your bedtime so you have complete digestion. Another tip for people with asthma, do not overeat and do not overfill yourself. Fill yourself. You want to always eat a little bit lesser than your normal quantity. Okay, and you want to chew your food and you want to eat slow. This is very important for people who have asthma, for everyone, not just people who have asthma. Warm water. Okay, you want to consume a mug of warm water at least 1 hour after every meal. Do not drink water with your meals. Or you may also want to consume a mug of warm water 1 hour before your meals or 30 minutes before your meals. But never with your meals. Consuming warm water is great for your lung health anyway. So while we're talking about warm water, let's talk about steam inhalation. Steam inhalation is great. If you're asthmatic, what you want to add is a teaspoon of ajwain seeds, caraway seeds, bishop's weed. This is like a spice. You take a teaspoon and you add it and you inhale. You do steam inhalation once or twice a day with the ajwain or the bishop's weed water. That's very powerful for you. Now, we've been researching this because when we've been reading scientific journals and naturopathic journals, something that works really well with asthma is inhaling honey. I know this may sound funny, but honey has something called higher alcohols, or we have something called ethereal oils in honey. So if you have raw honey, which is stored in a bottle, when you're having an asthmatic attack or you feel you have the onset of an attack, open that bottle and inhale the vapors of honey. This is known to soothe or to relax your bronchi. When it gets constricted, it allows it to relax. Now, we've tried this on a couple of people. Some of them swear by it. Some of them, they say it doesn't work at all. So you may want to try it and see if that works for you. The science behind it are the alcohols, the higher alcohols that help your bronchial tubes to basically relax. Something which is really powerful is garlic. Garlic, ginger, and turmeric. Now, a lot of people, if milk affects you, if milk brings on more mucus in you, if milk brings on more triggers for your asthma, do not consume milk at all. But if you're tolerant towards milk, you want to get a good brand, ethically sourced, A2 pure cow's milk. You want to boil 2 cloves of garlic and maybe half a teaspoon of grated ginger or mashed ginger. And you want to add a teaspoon of turmeric to that. This is a super powerful concoction for asthmatics, whether you're a kid, whether you're an adult. Now let's say you're Jane and you don't have garlic and you don't have ginger. That's fine. At least do the turmeric with the milk. If you cannot have milk, you can do the garlic, you can do the ginger and the turmeric with water. It is very, very effective with milk. So if you are not lactose intolerant and it's not an allergen for you, do it with milk. If not, you can do it with water. Turmeric milk, golden milk, also twice or thrice a day for an asthmatic child or an adult, if milk suits you, is fantastic for you. In the turmeric concoction, you always want to add a little bit of black pepper, because black pepper increases the bioavailability of the turmeric. So it is garlic, ginger, turmeric, milk, or water with a little bit of black pepper. What can you apply to your chest in case you have an asthmatic attack? Always keep cold pressed mustard oil at home. Little bit of mustard oil and a little bit of camphor. Mix it together and apply it on the chest. But very, very important, the moment you apply any mustard oil or any concoction with mustard on your chest, you want to make sure you cover yourself up really well. So you want to cover yourself or even wear like a coat or a jacket, because if you have just mustard on your skin and you're exposed to an air conditioner or a fan, you can actually bring on a very, very severe cold. So you always want to put that mustard concoction or that mustard with camphor on your chest and cover up yourself. Warm yourself up really, really well. We spoke about the ajwain steam inhalation. Okay, also the circadian rhythm of living. I'm going to send you that video link. Try to live the circadian way. The circadian clocks in your body has a lot to do with your asthmatic attacks. You must get sunshine. You must get fresh air. You must expose yourself to nature. People who have the ability to get into the sea, salt water as well, is great for asthma. It is great for asthma. Every time you align yourself with the cycles of nature, which is the circadian rhythm, you get better. Your conditions get better. We've put several children and adults with asthma in the circadian rhythm, and their frequency of their attacks have come down by almost 70 to 80%. So you must align yourself with nature, sunlight, nature, water. Very, very important. If you're dehydrated, your asthmatic attacks are going to be more. And the frequency as well as the intensity. Now, when it comes to fruits and vegetables, citrus fruits are great for you, for people who have asthma. Apples are also great because of the pectin. All your cruciferous vegetables, your broccoli, your cauliflower, your cabbage, your radish, all of these are great for you. Curcumin, turmeric, brilliant for you. Now, what's also worked for a lot of our patients, acupuncture, acupressure, brilliant. You find the right person to do it the right way, do it. We've seen fabulous results. Good homeopathy works very well with asthma. Good Ayurveda also works very well with asthma. Am I against allopathy? Absolutely not. If you need it, take it. But you need to understand that mostly they're steroids to shut down your immune system. How much will you take? So if you need it, take the medication that your doctors prescribe you. But there is so much more that you can do to change your lifestyle, to reduce your attacks, or even to grow out of your asthmatic attacks. So lastly, like I said, your cinnamon, ginger, honey, and lemon water in the morning. Lemon doesn't suit a lot of people. So if it doesn't suit you, you can still do ginger, you can still do cinnamon, and you can still do, what was the other thing? Honey, raw honey. So these are the things that you can do. But by far, making these lifestyle changes have been fantastic for patients, and pranayama is your magic drug. If you have an issue with your lungs, you want to train your lungs. So your morning breathing exercises, pausing in the afternoon to take about 6 to 8 deep breaths. There are several different breathing methods that you can also explore that can help you to handle your attacks of asthma way better. Now, if you're an adult and you get asthmatic attacks, something that really works well for you is black coffee. Because black coffee is a bronchodilator. So if you like it and it suits you, you want to have a mug of black coffee, and that can get you a lot of comfort and a lot of relief. So like I said, understand what asthma is. Understand how it works in your body. And there is a lot that you can do. Do not be the person who only reaches out to inhalers and drugs and steroids every time. Okay, if you need it, take it. I want you to be comfortable. I want you to be safe. But if you are not making all these changes on the side, okay, ask yourself, how many more steroids are you going to take? How much more are you going to compromise your overall immune system? Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.